There are 246 additional cases reported in today's numbers. They're all locally acquired. 90 of those cases are linked to known outbreaks and other cases. The rest are under investigation by our public health team. That takes us to a total of 1,786 cases. All but 4 of those are local. Just to go through the age breakdown, I know that's of interest to all Victorians. 273 of those are aged 0 to 9. 284 are aged 10 to 19, 456 are aged in their 20s, and 284 are aged in their 30s. There are 110 people in hospital, 30 of those are in ICU, 14 of those are on a ventilator. And just to give people a clear sense and hopefully remove any doubt that this is everybody's business, the age range of those ventilated patients is 17 years of age through to 76 years of age, and there are people in their 40s, 50s and 60s in between. So anyone can fall ill to this, anyone can become seriously ill to this virus, and that's why we all have to work so hard, and that's why it's so impressive that so many Victorians are doing the right thing to limit the spread of this virus. These numbers, obviously at 246, we want less cases rather than more, but if we acknowledge that this moves so quickly, our task, all of us together, is to limit the growth in the number of cases, to keep them lower than they would otherwise be. That buys our state time to get people through the vaccination program, and it also takes the pressure off our health system. Those 4 weeks that we spent in hard, fast lockdown has prevented 6,000 cases and 600 admissions to hospital. That puts us in a strong position. But it's very finely balanced, and that's why the rules apply to everybody, and it's why we all have to play our part. And that's why we're so proud and so pleased that so many Victorians are doing just that in extremely difficult circumstances. There were 32,300 vaccinations administered yesterday, a good strong day. That takes us to a total of 2,643,019 doses that have been administered in our state-run clinics. And I would just make the point that I think when we first signed up to this, we were due to do about 25% of the work. We're doing about 50% of the work, and it's a credit to the teams that are working at those 55 designated state-run hubs. They're doing a fantastic job, and of course it's a credit first and foremost to all of those Victorians who've come forward to get vaccinated. Today, we can report that we're at 61.4% first doses administered, so we've pushed through that important 60% first dose barrier, as it were, and we are well on our way to not just meeting our target of 1 million vaccinations over 5 weeks, but we're ahead of schedule, so it looks like we will in fact beat that number or reach the 1 million a little earlier than we had thought. Days, not weeks, but it's a mighty effort to have achieved so much in our state clinics to this point. 59,000 bookings were made yesterday. It's very encouraging, including more than 7,000 priority bookings for our senior students, our final year students who rang the phone number, albeit there was a lot of demand, as you always get whenever you open something up for the first time. We've got a few extra people on the call centre today, and hopefully that's smoothed out a little bit. But of course, when you've got 50, 60,000 people wanting something all at the one time, that can make it challenging for even an expanded system. So we thank those who are still making those calls to make those bookings. That's critically important to getting you to your exams and keeping you as safe as possible. I do want to make the point that there are, as I stand here right now, there are 11,400 AstraZeneca appointments available over the next 7 days. As so many people have said, as logic dictates, don't wait for the jab that might come in a month or two. Go and get yourself protected. Go and protect the people you love, and indeed play a part in protecting all of us. Please go online and book one of those 11,400 appointments. They're just waiting for your name to go beside them. And 6 weeks later, you can have your second dose, and then you can be fully double dosed. We are getting very close across Victoria. Perhaps this week we will meet the 1 million Victorians double dosed using the AstraZeneca vaccine. That is an amazing achievement. So what I'm asking you to do is essentially do what 1 million other Victorians have done. Go and get the vaccine that's available today. Don't wait a week or a month or even longer, this is a race, and the sooner we get to 80% double dose, the sooner we can be open and free, doing the things that we love, seeing each other, participating in something approaching, as normal as can be, the Victorian economy and indeed the Victorian community. 11,400 of those appointments available right now over the next 7 days. Please go online now and book one. I just again remind everyone, there's a process to be gone through. There'll be a doctor or a senior nurse or a pharmacist at each of our 55 clinics, and they will talk you through all the issues, and then hopefully you can make an informed choice to get your first dose, and then 6 weeks later get your second dose and be fully protected. None of the people that we've talked about today that are in hospital, to whom of course we send our best wishes and we thank the teams of people who are caring for them, but none of those people have had two doses, and only a very small number have had one. So this works. These vaccines are safe and they protect you against very, very serious illness. Illness that isn't just about having underlying conditions. Perfectly healthy people are becoming very unwell as a result of contracting this virus. There's every good reason for yourself, for the people you love, for the people who love you, and indeed for the broader Victorian community. Join the almost 1 million other Victorians who have got 2 doses of AstraZeneca. Play your part and help us get to that magical 80% number sooner than we otherwise would. The notion of doing 50% is really significant. To have done, going on double what we had said we would do. We're very proud to have a state hub system, a state vaccination system that is just flying along and doing enormous amounts of work, but it can do more. And that's why today I'm very pleased to announce that whilst we've increased our capacity in recent weeks, 25,000 per week, we will soon be able to add another 40,000 vaccinations each week. That's further significant growth, so we can play an even bigger part in this race to 80%. I can also announce that how we'll do that, some of the ways in which we'll do that. There'll be 25 additional cubicles that will be added at the Melbourne Town Hall, the Port Melbourne Town Hall, and at Eagle Stadium. A new vaccination centre will also be established at La Trobe Uni. There will be more cubicles at Sandown Racecourse, Wyndham, and the Eagle Stadium drive-through. And that'll mean we have an increase of about 50% capacity at each of those sites. So that's a significant boost. While additional cubicles at Melton Drive-Through Clinic will double its capacity each and every day, opening hours will also be extended across the system so that we can have more appointments and more people moving through our state-run hubs. As impressive as 50% of the total workload is, and the fact that we've got so many millions of jabs in arms across our state clinics, we know we can do more, and we're pushing the system every day to do more. That's what Victorians need and want, and that's what the government is delivering. There'll also be some additional pop-up sites, particularly focused on VCE students. So, for instance, Altona Badminton Centre and the Australian Islamic Centre in Newport. There'll be more information about lots of other pop-ups over time, but they're the announcements that we can make today in relation to further boosting the capacity of our state system. Another 40,000 people each and every week moving through that system. More than we said we'd do, but that's just the nature of these things. You've got to get on and get the job done. Now, I want to make a couple of comments in relation to some reporting last night in relation to vaccines and Victoria's fair share. And I don't do this with a sense of anger, although Victorians would be excused for being quite angry. But anger won't fix this. Only a change in policy from the Commonwealth Government will fix and remedy this for the future. I signed up to a national plan to vaccinate our nation, not a national plan to vaccinate Sydney. We have seen hundreds of thousands of vaccines that should have come and should now be in the arms of Victorians going into Sydney, into GP practices and into New South Wales. Now, I have been very clear all along the way. Some extra allocations, well, we don't begrudge that. Sydney are in a very difficult set of circumstances. But they were known. They were announced. This was not announced. This was done without anyone knowing. And the Commonwealth have got caught doing it. So it needs to stop. That's the first thing. And secondly, there needs to be a make good. There needs to be a reckoning where additional doses come to Victoria. I'll leave the Premiers of Queensland and West Australia to speak for what they think should happen. But there's something like 340,000 doses that have not come to Victoria that ought to have. That would mean we were closer to 70%. It would mean we were closer to 80%. It would mean we were closer to ending these lockdowns. So you can see a sense of frustration, and I'm sure in others a sense of anger. I did not sign up, and no Victorian signed up to a national plan to vaccinate Sydney. And whilst I've been very clear, the extra allocations that were given to them, known and announced and above board and clearly transparent, that was a good thing. We didn't begrudge them that. But let's be clear, we're not talking about those doses. We're talking about otherwise secret arrangements that are just not right. They need to stop, and there needs to be additional supplies provided to Victoria and other states who have missed out. That's as constructive and as clear as I can be. Getting angry about it won't fix it. Only the Commonwealth Government can fix it, and I would anticipate Minister Hunt, who's got quite a lot to say, quite often, had a lot to say last year, for instance. I would hope that he would sit and answer all your questions about how this has unfolded and how he's going to remedy it. But I don't begrudge any other state getting their fair share, but that's predicated on us getting our fair share. And, you know, we are a nation, and the national plan, which we helped write and which we've been absolutely 100% faithful to, and that won't change, the national plan is predicated on us all moving together. Now, some don't like to see this as a race, but a race it surely is. What I didn't know was that Premier Berejiklian's in a sprint while the rest of us are supposed to do some sort of egg and spoon thing. No, we want our fair share. These allocations, which are totally unfair and were under the table, need to stop, and we need to get a make good. We need to get those doses that we didn't get fast-tracked to us. That's as constructive as I can be. I want to be pretty plain-spoken on these things. I'm not about getting angry for its own sake. That achieves nothing. But these things need to be called out, because that's why we're pushing through 60% and we've still got a way to go on 70 and 80. We would be further along if not for these things. They can't be changed, but they have to stop, and then there has to be additional allocations made to our state. Our state hubs are doing an amazing job. Those GPs that are accredited and have got supply, they're doing a great job too. Only problem is there's a lot more of them been accredited and fully supplied in Sydney at the expense of everybody else. That's just not fair, and I would not be doing my job if I didn't call that out. To speak to the numbers of the day and the outbreaks that we're dealing with, I'll now pass to the Chief Health Officer.
Thank you, Premier. So 214 of today's 246 cases are in only 8 local government areas. There are 97 cases in Hume, where 48.2% of people have had their first dose of vaccine. 31 cases in Moreland, where 54.7% of people have had their first dose. 23 cases in Whittlesea, where that number is 49.8%. 17 cases in Wyndham at 58.5%. 15 cases in Hobson's Bay at 61.4%. 13 cases in Darebin at 54%. 11 cases in Brimbank at 51.5%. And 7 cases in Melton at 53.7% first dose. So largely stable in the west of Melbourne in terms of case numbers. We've seen a really significant uptick in the northern suburbs of Melbourne. So it does tell you that the west of Melbourne did what we asked of them a couple of weeks ago. These numbers reflect the change in behaviours, the isolation, quarantine, testing and following the rules. That needs to continue. The threat is still there in the west of Melbourne, and the emergent risks in the north of Melbourne should not be forgotten. Those cases have almost doubled in just 3 days. These vaccination numbers also tell you that there's a way to go. These are largely below the Victorian average for first doses, and so grab those AstraZeneca doses available, or otherwise book in for the appropriate vaccine for you. Because those individuals that the Premier spoke about in ICU, they are unvaccinated or not fully vaccinated individuals. That is almost universally true for those hospitalised. So if you're especially if you're over 60 years of age and you're waiting for a vaccine, please don't. Please get a vaccine that's available for you right now. If you've got concerns about medical conditions, high blood pressure, high cholesterol, if you've had a stroke, if you've got cancer, if you've recovered from cancer, if you're like me and you've had asthma, They are reasons to get vaccinated, not reasons to defer your vaccination. Can't be clearer than that. They are reasons to rush to get your vaccine rather than rushing to get a place in ICU. The transmission that's now, especially in the north, but continues in the west, we're looking at small businesses with strong community links and working with them on how they can protect the community. We know that there are many open and permitted to trade, but that is an opportunity for you to look at again your COVID safe plans and make sure that you're protecting those who are accessing your businesses as much as possible. You've got a responsibility to protect the community that are using your services and your business. That includes for QR code check-in, for wearing a mask and for appropriate social distancing. With respect to outbreaks active at the moment, there are 47 cases linked to Casa Suites in Coolaroo, 21 linked to Classy Kitchens in Craigieburn, 9 linked to Al Hajj Halal Meats in Glenroy. So if you live in Hume or northern suburbs of Glenroy, I want you to be extra vigilant for symptoms, to absolutely come forward at the first sign of symptoms and get tested and isolate until you've got that result. Be absolutely clear that this virus is serious. It can hit you head on. You can become unwell very quickly. You can require hospitalisation very quickly. So get tested and understand if you're a case, if you need to be linked in with care at the earliest possible time. On the other side of Melbourne, we've got 95 cases linked to Panorama construction site in Box Hill. And also of note, one case notified to the department yesterday was a nurse working at a hotel quarantine facility. Alfred Health have taken a very conservative approach to furloughing the close contacts there, and 31 staff from the hotel are currently isolating. The nurse and all of those contacts are in quarantine. There'll be further work to assess the impact, but the hotel is open for business. And investigations are underway into exactly how that infection was acquired, but no known PPE or protocol breaches. Tier 3 PPE worn by all staff, as you'd be aware, in hotel quarantine. On the school blitz yesterday, there were thousands of priority kids in Year 12, and those vaccinations do start today. That's very exciting. There are also Year 11s completing their 3-4 subjects who can also book from tomorrow. And the Blitz is really all about giving Year 12s the opportunity to head into exams. Some may welcome that, some may not, but it is a critical opportunity for them, and we need to make sure that we keep them as safe as we possibly can. On testing, 43,858 tests processed yesterday. Even if you're vaccinated and you've got symptoms, you need to get tested. If you're vaccinated and you've been to exposure sites, you need to get tested. So vaccination absolutely protects you, especially from serious illness. But you can become infected, you can pass it on to others, so you do need to get tested even as a fully vaccinated individual. If you need support while you're getting tested, there's that $450 payment if you haven't got sick leave available to you. If you need support for whatever reason, please reach out, go to that departmental website, www.coronavirus.vic.gov.au. We are here to support. There's been an enormous amount of work in community fora and networks, people sharing videos and advice via their WhatsApp connections and on Facebook groups. Please continue to do that. You reaching out to those around you, to those who trust you, and with your ability to share trusted information, that is really critical to get the word out. As the Premier said, it is absolutely a race. We've got the same number today as yesterday, but we're on, unfortunately, a slow but steady increase in numbers. We can turn this around. We will turn this around. It will plateau, but it'll plateau at a time when we've got sufficient vaccination coverage to drive those numbers down. And in the meantime, everything that you do right in terms of social distancing, wearing a mask, getting tested, quarantining, will buy us the time to get to that full vaccination coverage. Thank you.
Happy to take any questions you have.
I'd like to ask two on the vaccine issue. I want to understand what you mean by the secret allocations. So it was known at the time that New South Wales in the last couple of months were receiving more of the weekly allocations as well as more of the one-off Polish batches and a couple of others. Is it your view now that you didn't know how many more GPs were being brought online
absolutely.
and how much more those allocations were?
What's happened is additional points of presence and General Fruin has confirmed this. So let's not have any of this. I'm sure you're all getting lots of texts and lots of phone calls with lots of figures from the Commonwealth Government. Let's not be fooled by any of that, right? General Fruin has confirmed last night that what's happened is, with all due respect to the General, I mean, no way having a go at him. He's doing a fantastic job, and we have nothing but the highest regard for the work that he's doing. But he is running it, and he has confirmed that he had extra points of presence, as they call them, and it wasn't like, well, here's the national pool, you're going to have more points of presence, but you have to share your share amongst a greater number of spots. No, each and every one of the increased spots were fully allocated. Fully allocated. They received well more than a population share, and the Polish doses do not get led down that alleyway. The Polish doses do not account for this. I'm not quibbling about the Polish doses, and at the time I think you would credit me and you would remember that I said, fair enough, they're in trouble, give them a bigger share of that. But this is not, these were not announced. This is the outcome of decisions that have been made, but they were not announced. Now, I can't change that, and getting angry about it doesn't really serve any purpose. I'm just being clear, it has to stop. And what's more, there needs to be a square up. There needs to be the doses that we've not received, and they need to come to us now, not in 6 or 8 weeks, where all the way between now and then we have all this kind of chatter out of a number of federal ministers who it seems have nothing else to do but ring journalists and background about how apparently Victoria is not vaccinating enough people fast enough. We're doing 50%. I've struggled these last few weeks to try and work out why are our GPs so far behind New South Wales? Well, there's 2 reasons. The one we're talking about, and secondly, obviously a big outbreak drives people to go and get vaccinated quicker than would otherwise be the case. This needs to stop, and there needs to be a square up for the doses that have not come to us. Beyond that, I'm not really interested in having a debate about it. These are the facts, and no amount of, talk will change them. They are the facts. They were faithfully reported last night. They're not what we signed up for, and it needs to be fixed. That's what we should focus on. Let's stop this from happening. Let's make sure that the national plan, in fact, supports the nation, not one part of the nation. And again, I just make the point, I am in no way quarrelling or quibbling about the additional doses that publicly were announced and went to Sydney. Fair enough. And I said it at the time. I could have taken a different view, but I didn't. They've got a big problem now. Fair enough that they got those additional doses, but that's not what we're talking about. We're talking about other decisions that have seen hundreds of thousands of doses go into Sydney at the expense of other parts of our nation. That means that it's going to take us longer, despite our best efforts. They'll get to their 70 and 80 first because they had more vaccine to do it.
Just on the square up.
And we'll also make the point, and it's not about self-praise, because I'm not really into that, it's just, this is a fact. No one, I'm sure you would give me the credit, no one has pushed AstraZeneca stronger than our government has. That's why our numbers are solid. They could be so much better, we could be so much further along if in fact we'd been supplied fairly. But we can't change that. All we can do is make it very clear that that's unacceptable to us going forward, and there needs to be some reallocations. And one way you could do that, because I know it's stuff, you can't just dream this stuff up, like you've only got what you got, but one way you could do it, instead of waiting for these extra GPs that have now been agreed to be brought into the system in Victoria, that'll take some time. What you could do is, of the 1 million doses from London that's coming to our state, instead of doing 60-40, so 60% GPs, 40% to the state clinics, maybe we could have more than half of that. That won't change the total amount, but I think it'll get into people's arms faster. Not having to go at GPs, but if you're just setting up this week, if you only got accredited last week, or if you're in the process of getting accredited, that's going to take a little bit of time. We could maybe get those jabs into arms faster is all I'm saying. That's not a square up, that'd just be an allocation thing. But yeah, this is not what we wanted to see happen, and it needs to stop.
Just on the square up. So I think last night's report showed that the forward horizons show that our proportional share per population stays well below Sydney. Last weekend, you got a commitment from the Prime Minister that the future allocations would all be per population. Is it your understanding that that has just not been factored into the horizons, or has that been reneged on?
No, I wouldn't accuse the Prime Minister of that. I've not mentioned the Prime Minister until you did, and I've not spoken to him about this. Ministers have spoken. Martin has spoken to Minister Hunt, and I think officials have spoken as is appropriate. The Secretary of my department is in regular contact with General Frewen, and again, I just stress, no one is trying to involve him in something he ought not be involved in. He's running the show, so therefore, you know, it's not unreasonable for me to quote or to reference things that he said to us. He's doing a great job, and we wish him well. But these matters have been confirmed. There is then, quite urgently, the next comment is, well, and don't worry, you'll get yours later on. Well, we can't wait. We can't wait. This is a race, and we all need to get to 70 and 80 as fast as we can. And of course, if states get well more than their fair share, they'll get to 70 and 80% quicker than those it's at our expense and other states that there's been these additional allocations. It shouldn't happen, it has. Now it has to stop, and now there needs to be as best you can, a reallocation. Now, again, I fully concede that it's not like this stuff's growing on trees, but one thing you could do if you're about getting jabs in arms as fast as possible, if we got a majority, for instance, of the million, the English doses, no criticism of GPs, but I think we'd get them into arms probably a bit faster, just because there's a whole bunch of GPs coming on. We don't want all of it, but if you flip the 60-40 around, something like that, again, you know, I wouldn't be doing my job if I just sat here for politeness sake and didn't call this out. The key point is where we go to from now, and hopefully we don't see this happening again.
Going back to that Polish allocation, right back to the start when New South Wales got 500,000 allocated and we only got 175,000.
And I didn't begrudge them that.
Why
and that's not what we're talking
down?
about. We're talking about allocations well beyond that.
Understandably, but right back then, why didn't we put our foot down and say, why?
So I didn't quite hear the last bit.
I said, why didn't we put our foot down from the start saying we need more doses in Victoria here?
I'm at a slight disadvantage because I can't. Your mask is giving you such exquisite protection that I'm not necessarily hearing every word. I hope you're not criticising me for not having. You weren't, were you? Bagging Sydney for getting more before. No. They were entitled to the 500, right? That's all clear. We understood that and we said so at the time. These other allocations were not known to us. They've only become known to us because people have gone and done the figure work and there's some reporting. So, again, we can't change that. And I mean, at no point have we begrudged Sydney getting extra doses. We've been very clear on that. But that has to be known. That has to be announced. That has to be out in the open. Not the notion of approving a whole heap of extra GPs when you didn't do that here, and then providing all of those GPs with additional allocations. That just means there's more places to get vaccinated in Sydney, more vaccine in Sydney, and more people who have been vaccinated in Sydney. That is not the way the system is supposed to work. And hopefully it won't, and hopefully that'll change now.
Of the English doses, would you like to see 1.3 million or 1.4 million of those? I mean, that's been a windfall to Australia.
It has been a windfall. We have to give that. In the Prime Minister's defence, though, if he were here, he would say yes, but there's got to be a swap back. Those doses have to go back to England at a later point. What I don't want a situation where Victoria's treated like England, where New South Wales gets some of ours now and we get it back later. I'm not waiting till later. Why should Victorian wait until later? Doesn't make any sense. You can do all the swaps you want with other countries, but don't treat states in Australia as if they were a different country. We aren't. Allocate fairly, allocate equitably. If you want to provide more to a certain state, then say so. That's fine. And you'll get no argument from me, and there's never been an argument from us that Sydney needed more of those Polish doses. We did not quibble, not for a moment. But that was announced. That's very different to what's occurred since. And this notion that, oh, well, it's all fine and it'll all square up at the end, well, the longer it takes us to get to 70 and 80, the longer we'll be locked down. So
but would that be an easy
solution? I'm not very big on that. I'd prefer us to get to 70 and 80 really fast.
But would that be an easy solution? That hasn't completely been allocated as yet.
Well, part of the problem is remedying an unfair allocation with another unfair allocation is a little bit challenging, right? But they need, in the allocation of what's available, they need to square up. So, perhaps less goes to Sydney. That'd be new, wouldn't it?
So is what's happening?
Very new.
Is what's happening in Victoria right now a national emergency, like what New South Wales' Chief Health Officer declared, which sort of spurred on, the extra doses being allocated to them?
Oh, look, it's not about what you call it. It's about the facts that you face. We have cases growing. We're not in the situation that New South Wales is in, and that's why when they were allocated additional vaccine, we didn't have a problem with that. But as I said, that was announced. That was clear. That was out in the open. What's happened, unbeknownst to us and indeed many other states, I don't think anyone else was bought in on this. It's all about, you can wait and you'll get yours. They get extra now and you can get yours later on. Well, there is no later on. It's vaccinate now, get to 70, get to 80, get open, have a vaccinated economy, return to something approaching normal. That's what we all signed up to. We didn't sign up to anything different. The national plan is very important, and I have been a strong supporter of it, and I will continue to be. But part of that means when things are not consistent with the national plan, then I will call them out. Again, a quarrel doesn't work against this virus, but we're not doormats. We're just going to sit here and cop this and for politeness sake not say anything. We need a square up with this. It's up to the Commonwealth. They designed the system this way. They've created this problem. So they can perhaps, Minister Hunt can perhaps come and, rather than ringing you all off the record, maybe he can sit down and do a press conference and explain to you how he's going to fix this.
When did you become aware of it? The allocations, as well as the GP numbers and the pharmacy numbers, are all publicly available. They were reported in the Melbourne media 2 weekends ago. When did it become clear to the state that we were getting significantly less to our primary care network? Is this something that only came to light last night on television, or has this been a problem for months?
I wouldn't say months, but we've done some work to try and understand why it is that, despite the fact that our state clinics are doing very well and very strongly, we were somewhat behind. And I've raised at National Cabinet concerns about the fact that our GP network were not achieving the same amounts of. They weren't getting to as many people as what other states were, particularly New South Wales. And a lot of that, I think, was probably chalked down to the fact that they've got additional demand because they've got a really big and nasty outbreak going on. But when you look further, it's very clear that there are some other issues here. And again, going back over them, I think I've made my point very clear. It needs to stop, and there needs to be a fix to this, and that's making good, not in 2 months, but far sooner than that, on the allocations that have gone to other states that should rightfully have come to us. And again, I stress, not the Polish stuff. No one has argued against that. But this is not the Polish vaccine. And you'll be told that it is. Be certain of that. That's not correct.
I just want to be super
I don't think
clear.
the General will tell you that. Others may, but I don't think General Frewen will.
I promise Greg Hunt's not messaging me throughout this press conference, but I just want to be clear about what you didn't know about the allocations. So,
well, we did not know that there had been additional points of presence and that they'd all been fully supplied. The notion, this extra supply is well and truly above what we were informed of. Now, if you're saying we should have been better detectives, well, we've all got a bit on. Ultimately, is that really the way the thing should work? That everyone's got to sleuth their way to a decent and fair allocation? No, that's not what we signed up for. That's not the way it should work. But it's pretty clear now, and it needs to stop, and I'd be confident that it will.
Are you going to talk to the Prime Minister about your request for what you're keen to get?
He knows my views on these matters. Ministers have spoken, officials have spoken. It's not about getting angry about it. That doesn't work. But you've got to call it out, and it needs to stop. And I'd be very, very confident, because that's what we were communicated through last night. We were communicated that perhaps wouldn't be continuing, and that there would be additional allocations made at some point in the future. Well, that's great, except we need them now. And they're not sitting in a warehouse in Sydney. They're in people's arms. And they'd be in Victorians' arms if they'd been fairly allocated to us, or at least if we'd been given the courtesy of having a discussion. Maybe if there'd been a discussion to say, look, actually, New South Wales needs even more, well, then maybe we would have agreed to that. Maybe. We weren't even asked.
Can you give more detail about what the extra allocation that they indicated we might get? Can you give any more detail about what we're likely to get?
No, they've not. No. I think the federal government and the Horizons document talks about all of this evening up at some point in the future. That's to be seen. That's to be seen. And we'll never say no to vaccine, but obviously vaccine that comes to us in November is not quite the same as vaccine that comes to us in September when we are locked down. And we want to get out of that. And vaccination is the way to do that.
Premier, Channel 9's got footage again of an Orthodox community in Melbourne breaching restrictions overnight in a gathering. I appreciate you probably haven't seen the footage, but
I haven't.
Wondering what your message would be, given that we saw 3 weeks ago the incident at the engagement party, that this message getting through to communities who appear to feel they're above the law.
Yeah, look, I understand that for people, I assume this, I'm not sure if it's a faith gathering or cultural gathering, whatever it is. I understand this has been a very difficult year for lots of people. They can't go and do the things that they want to do. But if we don't follow these rules, then we will all have to wait longer to do the things that we want to do. That's why the rules apply to everybody. And whether it's having your friends around at home and inadvertently videoing it, or an engagement party, or whatever it might be, it's just not right. And, you know, I'm just asking people, please do everything you can to follow these rules, because they're about keeping you safe. There's a 17-year-old on a ventilator as I speak. There are people in their 40s and 50s that are on ventilators as I speak. That's just here, let alone up in Sydney. So look, I don't know, I haven't seen the footage. I don't want to cast any aspersions against any groups or any section of our Victorian community. I will again, just for the avoidance of any doubt. The Jewish community called out that behaviour and were very quick to do it, and I'm very grateful to Jewish community leaders for doing that. This is a time of high holidays. It's a time of very, very significant, it's a very significant time. We've all got to be safe in everything we do, regardless of what might motivate us. But the Jewish community, by and large, done a great job, and their leaders called it out. They called it out strongly, and I'm very grateful for that.
Just on gatherings and the safety of them, Dramana Drive-In is trying to do what they tried last year, and that is have a grand final day event with people in cars. The government saw issue with that and you know, had to close it down last year. We're arguably in a worse position this year. Would you have you put your mind to grand final day events this year?
I'm not certain whether they've made application to the public health team for an event to be approved. Going to the drive-in is not one of the 5 reasons you can leave your home. So unless and until we announce otherwise, that type of a gathering would not be appropriate. You know, let's all get vaccinated, and then we can get back to normal. We can get past this. That's why we're very keen to have our fair share of vaccines. It's why today I'm announcing we're going to increase our capacity at state hubs by another 40,000 a week. You know, we cannot do more at the moment. We are pushing as hard as we can. AstraZeneca's available. Get that now. Don't wait for some Pfizer shipment that hasn't come yet. Don't get in, and also, can I say, with respect to older Victorians, don't get in a queue behind 12-year-olds. They can only get Pfizer. If you wait in the queue with them, you'll be waiting a long time. Please go and see your GP or come to one of our clinics, and we'll take you through all the steps, and hopefully you can make a positive choice and you can get single dosed, then double dosed, and you'll be protected. As I said, no one in hospital, certainly no one that's gravely ill, has been double dosed. It works. They're amazing products. They work against the most serious of illness. That's why you've got to get the one that's available now. And pleasingly, we've got this week, I think later this week, we will tick over 1 million Victorians double dosed with the AstraZeneca vaccine. Do what millions of others are doing. Not just here, but indeed right across the world.
Premier, we're seeing private gatherings happening though, people breaching, you know, and it must be very frustrating to you. We've got the grand final day holiday. It's still happening, obviously. Is like the end of school holidays a point of nervousness for government about super spreading events and these numbers rapidly going up because of people holding events on that day?
Look, every day when I get a report from Victoria Police about what's occurred in the previous 24 hours, you know, it's not a matter of being nervous, but what I know and what every single Victorian I think deep down knows, when you look at what we've been through, movement means infection. Visiting people, you will bring the virus with you. You will take the virus to those you love the most. Some of them will get very sick. Why would you do that? Spend Grand Final Friday going and getting vaccinated. There are thousands of appointments. We're expanding hours. We're increasing the number of cubicles at so many of these sites. We're going to be able to do another 40,000 per week very, very soon. We are through the 60% barrier. We'll get to 70% sooner if more and more people get vaccinated. in the coming days. I think we're going to be ahead of the 23rd of September, which is good news. It's hard to be absolutely precise on how much earlier than the 23rd of September. But again, look, I just appeal to people. You can, if you break the rules, then we'll be in lockdown longer. It's as simple as that. Instead of breaking the rules, go and get yourself vaccinated, protect yourself and all the people you love, and protect everybody. That's and be able to participate in the economy fully once we do open. That's the other point that we've made very clearly. I am not going to lock the state down to protect people who won't protect themselves. So we've got a few supply issues now, but lots of AstraZeneca. It's available. Get that jab today. Beyond that, it's just going to take us a little bit of time to get to 70 and 80, but once we do, then we'll open up all right, but we'll be open to those who are double vaccinated. There will be limitations on those who are not, by choice, I'd stress. If you can't get vaccinated, then that's a different issue. But that's a very small number of people. I would just say I wouldn't want anyone to read into my comments today or any day that I think there's hesitancy out there. I think that people genuinely want to get vaccinated, and whenever we open up to a new age group, or we open up new sites, or we expand I think the country's only drive-through vaccination centres, we're overwhelmed. People want to get vaccinated. That's why we've just got to keep the supply up. We've got to get a better distribution out of the national plan, and we've just got to get people to don't think it's for next week or next month. Please go online today and snap up one of those 11,400 AstraZeneca appointments, because every single jab counts towards us getting to 70% and then 80% and then getting open and staying open. That's what we're all after.
Premier, one more question. Sorry, Veron, and I'll shut up.
You don't need to.
Well,
you can keep on
might.
going. That's
I don't
fine.
know. We've actually been shown documents, letters from GPs written for patients who are above 60, appearing to do them favours to show at the state-run hubs, my client, my patient needs Pfizer over AZ because of medical conditions that aren't listed in these letters, that there is no evidence of. Would you... have you heard of this issue, or would you caution GPs in trying to put patients ahead of the queue to get Pfizer when they should be getting AZ?
Well, I would. The letter that matters is the one that the Prime Minister has sent to everybody over 60. He's made it clear that it's AstraZeneca, or you're going to be right at the back of the queue. Now, consulting with your doctor is always important, and doctors will advocate for their patients as you would expect. But I haven't heard of that. I have heard of employers writing letters to clarify that somebody is in an exempt category. Sorry, not exempt, in a priority category, whether they're a health worker or something like that. But no, I've not heard of that happening. But I just say the letter that matters is the one that the Prime Minister sent to everyone over 60, confirming that they'll not be taking Pfizer doses off kids, because kids can't take AstraZeneca. You need to take AstraZeneca, unless you've got a very good medical reason not to, and it's not for me to tell you that. That's for your GP. But if you come to one of our clinics, we've 55 of them, we've got teams on hand to talk to you about what it means for you, to take you through all those issues, and then you can make an informed choice. And it's not like I'm asking you to do something that other people aren't doing. We're nearly up to 1 million double-dosed. I think we're close to 2.6 million AstraZeneca jabs, mixture of first and second. But we've nearly got 1 million. We're very close, and we should tip over that mark this week, and that's fantastic. That's fantastic. It's a vaccine that works. It's highly effective. It's been through a rigorous approval process. It's made right here. Go and get the AstraZeneca jab. Get one of those 11,400 appointments. One
more thing, Matthew Guy, what do you think?
Oh, look, it's a great honour to lead your party, and Matthew doesn't need me to tell him that. He knows that.
But do you see him as a threat to the Victorian government's leadership through COVID? He said he's going to create a whole new plan and alternative policies and be positive.
Well, we're working very hard to deliver the national plan. That's the plan that I'm focused on.
If he offered to work with you on getting Victoria out of COVID, would you accept that offer?
Well, I think all Victorians should work together. We're all in this together. The notion, this virus doesn't discriminate based on who you vote for.
So
this virus is everybody's business, and that's why it's really important that all of us are as constructive, as science-based, as evidence-based as possible. Some who deny that the virus is real, that doesn't make any sense. Some who play politics with this virus, that doesn't work either.
Well, the Liberal Party has done that.
We all have to work together, and I think that's always been the case.
But given the low blow attacks on you that we've seen from that party in the last few months, and things that have been circulated about your your injury to your back and then those sorts of things, would you work with this new opposition leader if he offered it?
Oh, look, I work for the people of Victoria every single day, and if anyone wants to join me in working for the people of Victoria, I'll gladly welcome them. You know, I don't know that there's much more that I can say.
I'm sure there is.
Sorry? No, I've been very busy. What I will say, though, is I would send my best wishes to Michael O'Brien. This will be a very, very difficult day for him and his family. A very, very difficult day. So I do. I send my best wishes. But Matthew doesn't need me to congratulate him on being elected to lead his party. He's done it before. He knows exactly how much of an honour it is.
Can I just ask on the, I think you flagged it maybe on the weekend, about the potential plan down the track to allow people stranded in New South Wales to do home quarantine?
Yes.
Do you anticipate, do you have any idea about when that might be?
I hope to be able to make announcements about different groups within that broader group very, very soon. In coming days, hopefully, I'll be able to talk. It won't be everybody coming back at once. The Prime Minister, and this is why I'm not pleased to have to have covered some of the ground we've covered today. I have a very good relationship with the Prime Minister. I work very closely with him because that's what these times demand, and you get better outcomes when you work together. He and I have agreed in a meeting I had with him last Wednesday evening, I've agreed, and I think New South Wales have agreed as well, to do a home-based quarantine pilot. We'll do that. Technology will be part of it, and we'll get those Victorians who are principally in New South Wales, we'll get them home. We can't have everybody come at once, but we'll make further announcements about that soon.
In lots or like a very small pilot?
Well, I want to get them all home at some point. The question is, I can't necessarily have 3,000 or 4,000 people coming home right now and pretend that we've got resources to be checking that they're all doing the right thing. There are some on the border though who have been there for a period of time, and we'll certainly have more to say about them very soon. Today's not the day to announce those matters, but when we're ready, and it'll be soon, we will have more to say about that.
So could the pilot include people in Sydney, in metropolitan Sydney?
We'll have to wait and see.
December for vaccine appointments. It's great that people are booked in, but is it too long for some people to be waiting for their first dose?
Oh, look, again, I don't want to go back over the ground we've already well and truly covered. But obviously, the more GPs we have in the system, the more vaccine they get, the more appointments are on offer. And logic just tells you that means more people will be able to get their jab now, not waiting till the end of the year. My message has been consistently, get the jab that's on offer. Get the one that's there right now. Don't defer. I'm not criticising anybody who's booked in sometime later, but as I said, this is a race, and we all need to be doing everything we can to get to 70, then get to 80, and then do exactly what the national plan says. Don't lock down the whole place, but instead lock out people who are, by choice, not part of that 80%, in the hope that that encourages them to go and get vaccinated, and in the hope that we can take as much pressure as possible off our nurses and others, but principally our nurses. You know, they're in for a pretty tough time coming up. We're going to see hospital admissions grow, just as they are in Sydney. Hopefully we can avoid those sorts of numbers, but all of us have a part to play in that, all of us, whether it's following the rules and much as we'd like to go to a grand final barbecue, not doing that, because that will just spread the virus, all the way through to booking an AstraZeneca appointment, one of 11,000, hopefully less than 11,400 since we've been talking about it.
Regional lockdown.
Sorry, what day?
What day will you make an announcement on the regional lockdown?
It'll be later on this week, I'm not quite certain. No, I want to confirm though, no decision's been made, so there'll be meetings today, tomorrow, and I think our form has been that when we've made a decision, we'll announce it very soon thereafter. But you want the most contemporary picture, and we've seen in recent times, given the spike in cases and how quickly that happened, that circumstances can change. But we're on track to be able to do some easing. It will not be, I think as the Minister indicated yesterday, it's not a snapback, it's not Freedom Day and everything's open at 100%, but there will be, we hope, and we're working towards being able to lift that lockdown, but there will still be restrictions in country Victoria, and we'll make those announcements as soon as we can.
Have the two positive...
Yeah, all of those.
Some freedoms to get the economy going.
Well, obviously, once you lift the lockdown, then there's a whole lot of businesses that can reopen, but there will be limitations. It won't be, hundreds and hundreds and hundreds of people inside. It'll have to be more modest than that, because the last thing you want is virus spreading and then having to go back into lockdown. So, country Victorians have done an amazing job. All Victorians have, but in keeping these numbers down, I want to give a shout out again to the Goulburn Valley. They've done an amazing job under very, very difficult circumstances. but the numbers are low. They're not necessarily zero, but they are low, and we think that we'll be able to make those changes, but no decision's been made yet. It'll be made one way or the other in coming days, and we'll be sure to announce it very soon thereafter.
Looks like Ballarat has possibly wastewater detections, possibly more than that. Then obviously we've got Shepparton. Are you looking at putting some sort of barrier around those areas?
Well, certainly Shepparton has still got the sort of remnants of their outbreak to deal with. We've moved well and truly through the day 13 testing. There's been some small number of positives out of that, but it's it's in a different category, and I think we've been very clear from the last couple of weeks that Shepparton may have to be just a little bit behind the rest of regional Victoria, and then it can catch up soon. You know, not hopefully weeks and weeks behind, but we won't hold back the rest of regional Victoria because of what's happening in Shepparton.
So Ballarat will be okay?
I've got no advice about Ballarat beyond that. We get sewage detections in lots of different places, and that's why we call people to test anyone who's symptomatic in those areas. That's why we do all that contact tracing and talk about exposure sites and all those things in the hope that we can, know or get the most complete picture, and then you can make the best judgments. But again, we're not here today to announce what's happening in regional Victoria. We'll do that as soon as the decision's made, and that has not been made yet.
I mean, what's the thinking around schools? When are schools, you said you were going to make an announcement about the plan for schools. How's the work ongoing on that? And is that targeted to a vaccine rate, a hospitalisation rate, or a case number rate?
So there's an enormous amount of work, and I spoke to some of this last Friday, I think it was. The Burnet are doing some modelling for us. That's not yet finalised. They do a lot of work for us. They're kind of refreshing their work, given the circumstances we're in. There'll be two lines on the graph, essentially. There'll be the number of cases and how they're going to grow, and then there's the amount of hospital capacity that we have and how it flexes up. And of course, you can turn parts of the hospital system off to focus purely on COVID, but not all of it, because of course there are lots of other urgent cases and time-critical care that's needed. Whenever you turn off elective surgery too, there is significant outcomes from that. Well, that's not the first thing you would do. So we have to ease within those two lines so that we can have more freedom, and that's why the on or about the 23rd is mainly social things. It's not all the schools going back. We've been very clear that term 3 will not be a return to face-to-face learning. Term 4 we'll have a detailed plan, but again that's got to be based on evidence. It's got to be based on how many cases are in the community. If we have many cases in the community, like much more than we have now, then that's going to limit our options around school. Because what happens is, I won't open them unless I get advice to do so. I don't have advice to do that now. When I get advice to open them up, and we're already well and truly advanced on a detailed plan, but it will depend on how many cases are out there. And what we don't want, surely all of us could agree on this, we don't want a situation where we open schools and then one by one they all close because they finish up with cases. We know what happens. That's parents will keep their kids at home. We won't even get a chance to close the system down again. Parents will make that choice. So we're still a little way off from that, but as soon as we're ready to make those announcements, we absolutely will.
And will it be a school closes because of one case, or would it be the class gets sent home or that year level?
There's been a protocol. Part of the work that's being done is to make sure that those protocols are fit for purpose in the current environment, and particularly Delta. And of course that our littlest kids can't get the vaccine. Our younger Victorians, our older students are still moving through the system. And again, we'll have more to say about the rest of those year levels getting vaccinated in due course. But all of that will be included when we're in a position to clarify for parents, for students, for teachers and staff what term 4 will look like, what term 4 can safely look like. And that's the thing, these things can sometimes seem very easy, but when you start digging into it, it's a good deal more complicated. So we just got to work through this in an orderly way, and with plenty of time, we'll have more to say about that, and many other things, like our vaccinated economy trials, so the notion of some outdoor drinking and dining, for instance. If and when we get regional Victoria open, that's the perfect place for us to do some of that trial work so that the apps all work and the databases can talk to each other. Whether you've been vaccinated, that's data held at the federal level. The Services Victoria app is obviously state. We've got a lot of works going on to kind of interface those two. All of those things, there's an enormous amount of work going on so that we're ready when we get to 70 and 80. That'll give us options. That'll give us all of those options. And of course, there's a lot said about plans. The key point here is that there's a national plan. That's our plan out of this. And we are faithful to that, and we will continue to be.
case numbers. How did today's case numbers impact how we're reopening? I mean, half of them are infectious whilst in the community, so over 156. We've got the toughest draconian measures in place. There's not much we can do. Victorians are already sacrificing.
Well, I suppose I don't want to go back over ground we've covered many, many times, but if we all play a part, which is get tested when we have symptoms, isolate when you're told to, go and get vaccinated, book an appointment, book one of those 11,000 appointments I've talked about this morning, then we can keep and follow the rules in a broader context. We can keep the numbers will grow, but they will be lower than they'd otherwise be. They won't get completely away from us and put all sorts of pressure on our health system, and therefore mean we have less options to ease, far less options to ease. So the lower the case number, the more options we'll have, and the more freedoms we'll be able to give back to the Victorian community faster. The more people get vaccinated, that obviously helps too, because that's the ultimate aim, to get to 70 and to get to 80. And once you're at 80% double dose, we won't stop then, we'll keep pushing, but that's the key marker. That's the key marker for us to be able to end lockdowns, to be open, to have a degree of freedom that we just can't have at the moment, because if we did, then it wouldn't be 200 cases we were reporting today or 250, it'd be many thousands. And our nurses would be sitting there waiting to deal with the inevitable consequences of that. And look, the numbers hold up. It's about 1 in 10. 1 in 10 finish up in hospital, not in ICU, but 1 in 10 finish up in hospital. And you know, nurses are amazing, but they have limits, and we don't have literally, you know, hundreds and hundreds of thousands of them. So we have to manage that, and it's painful. It's very difficult. We'd all like to be doing many more things that are much closer to normal. But if we tried to do that, that'd be to pretend that this is over. It won't be over until we get people vaccinated.
Do you think we're on the same trajectory as Sydney? It's very concerning, obviously, seeing what's happening across the border.
Well, it is. I think part of the challenge at the moment is the Burnet's still doing that work, and we'll be in a position to have go through that in more detail, I think, once they've concluded that work. And the very reason we asked them to do it is so we can get, as best as possible, the most complete picture of where are cases now, where will they be in a week, a fortnight, a month, and then that gives us those, as I said, those kind of two lines. Here's the hospital capacity, here's the case numbers. The gap between them, that's the room we have to move. It is not Freedom Day stuff, though, until you get to that 80%. And even then, things like masks may well be a really important part of trying to limit the spread. And why is that important? It's easy, I suppose, for people to say, well, I'm vaccinated, I don't really care about those who aren't. The problem is if it rages through the unvaccinated, they'll fill our hospitals as well after 80%, and then there's all sorts of knock-ons for people who are not COVID patients and who are vaccinated and have, you know, done everything they can to protect themselves and others. People with heart attacks and strokes and car accidents and all those sorts of things.
And just on the easing of restrictions, the New South Wales Deputy Premier has ruled out COVID curfew for regional Victoria, saying that there's no evidence to get case numbers down. I just wanted your comment on that.
Oh, look, I've never said that you can attribute a absolutely precise percentage of case reduction. I've never made that case. It is a suite of measures, and in total, evidence tells us they will limit the number of cases. Will they drive it down to zero with Delta? No, and we've been very clear about that. But what I can say to you is that 15 to 20% reductions in public transport usage during curfew hours, and 15 to 20% reduction in traffic volumes during curfew hours, that says to me that's less movement, and in many respects, movement is the biggest challenge. People moving around. That's why we regrettably have to have lockdowns on.
So we've seen it have a tangible difference here in Victoria then?
Well, it's very difficult. Your next question will be, well, thanks for that, Premier, how much? And I can't give you a precise, and I've never claimed to give people a precise, unpack every single rule, every single measure, and attribute to that individual percentages of benefit. That's not a claim I've made, so I'm not going to justify claims I haven't made, because I haven't made them. It's part of a package. The best piece of evidence about any particular measure, the Burnett did a very comprehensive piece of work on masks, and I would direct you to that. That has been unpacked, and that's like 40–50% of the overall benefit can be attributable to masks. That's from our second wave last year. That might need to be updated for Delta. But
Sorry, this may be one for the Cho, but are you aware of a delay or a lag in exposure sites being contacted by the department? We know there's a deli in Rathdown, had a positive staff member, that was Friday, still waiting to hear whether they're Tier 1 or Tier 2.
I'm not aware of that, but I can chase it up for you.
But are you aware overall that there may be, because we've got so many cases and so many exposure
I think
sites?
people are keeping up, but I would just say it's a big team and they're working incredibly hard. They're all doing their very best, but obviously if you're chasing 20 cases a day, that's a different task and a different challenge than chasing 250 or indeed more. I'm happy to follow that example up. It is often the case. Now, I was asked before about whether we should all work together. Absolutely we should, and this is something that we all work together on. So businesses, for instance, will be informed of their exposure site status. They will reach out, rather than giving us all the numbers and details of their staff, waiting for us to do it, they'll reach out to their staff and they'll provide them to us. So we're all chasing the same people and we get the message out as fast as we possibly can. It's why, for instance, we have regrettably, not often, but we have regrettably put things up on the website that might not have been 100% accurate, because we're trying to get as much information to people as fast as possible. But on that particular business, I'm happy to chase that up for you.
So I suppose your advice then to that business, if they're waiting, they want to do the right thing and either tell their staff and customers to isolate for 14 days or...
My advice will be conveyed to them via the public health team, because you've raised it with me and I'll get someone to call them.
Okay, another quick one. With so many active cases at the moment, is it time that we have a direct line for patients at home or a dedicated hotline? People are saying they're struggling to get through on the coronavirus hotline and they need support.
Sure, I'm happy to chase that up. Anyone who's COVID positive is in a pathway and they have dedicated teams of people that care for them or that they can contact. They're part of the system, if you like. They're already logged into the system. It's called a pathway because people can, again, this is the fact, you can deteriorate reasonably quickly. So it's important that they're already part of the system. Where you see patients turning up to hospital, turning up to the ED, for instance, for the very first time, that's the system not working because they weren't tested, they weren't part of a pathway. They've deteriorated really fast, and tragically we've seen at least one person lose their life in exactly those circumstances recently. I'm always happy to try and get more information out to more people, provide the best care and support as possible. That people are incredibly patient, and I'm so grateful for that, because even with such a strongly resourced health system, even with such tremendous health professionals, demand is a real challenge. And they're busy on any non-COVID day, they're very busy already. When you add in all these cases and all these hospital admissions and what they're trying to be ready for, it is the best of work, and they do an absolutely amazing job.
Do you have an exact figure of the number of the added doses that you want to see here in Victoria?
No, we're going to go back and double and triple check all that and make sure that it can be as many as 300,000. Now I fully acknowledge it. It's not like there's a stockpile out the back and you can just. But when the allocations come for these UK doses, I hope there's a recognition that there has been an increased allocation, if we be the politest way of putting it, to New South Wales. Not Polish. I'm talking about other stuff that's happened. Hopefully things can be squared up there. But I understand it's the art of the possible. It's not like there are literally, warehouses full of Pfizer. That's why getting an AstraZeneca jab is not only an option, for many people it is the best option. Right now, available. We've got plenty of it. When those appointments are gone, we'll have more appointments. When they're gone, I'll order more of it and it will turn up. No swaps. We've got access to very, very strong supplies. We've pushed it because it works. It absolutely works. And the more people who get an AstraZeneca jab today, the sooner we'll get to 70%, and then 80%, and then we'll be open. And we won't be doing lockdowns anymore. We'll be doing lockouts instead. But we'll keep pushing though. 80 won't be enough. We want 81, 82, whatever we can get to. But 80% is the key number, and that's the key point here. If it's a race, everyone needs to be running on the same track over the same distance. The finish line needs to be in the same place for everyone. That's the point that I'm making. Well or otherwise, you can work that out.
And on the regional lockdown, have those 2 positive truckies identified yesterday in northern Victoria, has that impacted your decision or delayed potentially?
No, I don't believe so. I don't believe so. We'll look at wastewater, we'll look at case numbers, we'll look at all manner of different things. Case numbers in Melbourne are obviously relevant too, because we have to be confident that people won't travel to regional Victoria other than for permitted reasons. And then we'll have to look at what's fair and reasonable and doesn't make almost certain that we have to lock down regional Victoria again. You could go and do a whole lot of stuff, but what you'd be doing, you would know as you did it that it'll just spread, and then we'll be back where we are now. We've got to try and avoid that, and that's a really difficult balance, but I think it's one that we can strike. We've done it in the past, and we'll have more to say about that soon. Any other issues, guys?
Sorry, the grand final parade. If
Yes.
Perth wants to hold it, what would you think of that, or would you rather keep it as Melbourne's own, Victoria's own?
That's a matter for the AFL, I expect. The grand final's being held there, so
But obviously it's a
how
huge
they seek to celebrate it. Have we got a trademark on that?
I don't know. It's a pretty big Victorian
It
event.
is a big Victorian
so
thing, and hopefully it'll be. If we all get vaccinated, it'll be back here next year with a big crowd, and hopefully Essendon will be in it.
Can I ask you on one more other topic? Darebin City Council is advertising jobs for street sweepers, but looking for female-only applicants to apply. What do you make of that?
I saw that. That's got nothing to do with the Victorian government. My position has always been that people should be treated equally. So that's a matter for Darebin Council, and I'll make a bold prediction. I will not sit here ever and try and unravel the mysteries of the Darebin Council for you or anyone else. Thank you very much.
Brother Bell.